So hello, everybody. I am happy today to be joined by a colleague of mine from the EMDR world, Dr. Julie Bindeman. And Dr. Julie is a perinatal mental health specialist. So I'm hoping you could start by telling our listeners what that even means, perinatal mental health.
Sure. So I actually, as I make it easier for people, I call myself a reproductive psychologist because I feel like that encapsulates it in a way that's more accessible. So when we're talking about the perinatal period, we might be talking about the time during pregnancy, we might be talking about the time after pregnancy. But what I like about the idea of reproductive is it also frames the time leading up to pregnancy, which I don't think is as inclusive in the word perinatal. So peri is within, natal is baby, just to give you a sense of where that word comes from. So I do all the things related from infertility, pregnancy loss, birth trauma, perinatal mental health issues, all of the things.
And you specifically have a specialty in all things connected to abortion. So help us understand a little bit about what that part of your work looks like.
Yeah, absolutely. So I look at it as there are a couple of buckets that I do. I help people who find themselves pregnant and aren't even sure if they want to be pregnant or not. And so I refer to that as discernment counseling. Like, okay, let's talk about that. Let's think about what might be useful or what might not be useful about continuing on either path that you might choose. And it's not my place to judge or make a decision for someone. It's my place to create space and to allow them to go through their own process. And then there's a group of people that I work with, most of who have terminated for medical reasons. And what that might mean is that they've had abortions because they found out that the child that was very wanted has some kind of fetal abnormality, or that their health is at risk by continuing a pregnancy. And so it puts them in a place where medically they need to decide to have an abortion. And that has a whole lot of different nuance to it, particularly in the world that we're living in right now.
So, a phrase that has been commonly used as a social media hashtag is abortion is healthcare. Tell us what that means to you.
Abortion is healthcare, it's part of reproductive health. So there are a lot of reasons in which abortion care, which, oh, by the way, is the same procedures we use for miscarriage management. It's the same procedures we use for ectopic pregnancies. It's what we need to use if somebody is coming into the hospital about to die because they're pregnant and their water is broken and they're 18 weeks and there's no way we can help that baby, but we can give them abortion so they don't have sepsis and they die. So when I look at abortion as healthcare, I'm looking at these really common things that happen to people. And by restricting abortion, this is not just me, catastrophizing about what might happen. This is actually happening. We lose providers. We lose maternity wards at hospitals. We lose talent like maternal fetal medicine specialists. When our OBGYNs retire, we have no one to replace them because with restrictive laws, no one wants to train in those states. A case in point is Idaho. They are a maternity desert. They have like 2 MFMs now in the state. In the state. It's a big state. So if you're coming from one part of the state, like that's several hours drive just to get a second opinion about something. Or if you need special kind of fetal monitoring, that's a whole lot of effort. That's not serving people. So we're creating these deserts in healthcare. It would be the same thing if I said to you, like, if for whatever reason we were saying, you know what, somebody needs to have a heartbeat as long as they have a heartbeat. And so we're going to start legislating around cardiologists and what they're allowed to do. I mean, I could see, Jamie, you're trying not to laugh because it sounds preposterous. But those states that decide to legislate around cardiologists stop having cardiologists training in those states. And then they have increased numbers of cardio issues that could have been dealt with if there was a trained professional intervening.
Yeah, and I don't know if I want to laugh or explode, because what I very much hear you saying is these maternity deserts of which you're speaking is the impact of conservative politics, is the impact of this legislative punishment on women in birthing.
Look at the recent class of fellows, right? And look at where they are going to train. So I can tell you where they are not going. They did not go to Florida. They did not go to Oklahoma. They did not go to Texas. They did not go to Idaho. They're not going to places where they can't get the training that is required to do their craft. So if you are a gynecologist or an obstetrician, you need to learn how to do dilation and cutterages, D&Cs, because people have miscarriages, they need them. So this is not just about abortion care. This is about healthcare. So the hashtag abortion is healthcare, pretty apt.
Yes. So you are based in the Washington, D.C., Maryland area. You well know what's going on in Ohio and how we're voting here on October 10th is the date to register. And we'll put registration linked in the show notes here. November 7th is the election and be open for early voting. So what I wanted to run by you, because as I've gotten to know you, I'm really impressed with your knowledge of the research and the science, which, we know is off-putting to some people, but there are a lot of people who are really deciding on how they're going to vote on this. So, to clarify, and you could read this, it's in plain language anywhere online from a neutral source. What we're voting on in Ohio is a restoration to the rights that we had under Roe versus Wade. The simplest way I can put it.
So wait, you're getting back rights that got taken away from you. Is that right?
Yeah.
Okay.
Correct. But what I wanted to run by you, especially because you're so knowledgeable here, is a lot of the most common protests that I hear from other Ohioans that I try to talk to. And, there are some people I meet who I would consider pretty middle of the road politically, religiously, but they'll say, I just don't want to sign off on people using abortion as healthcare. And usually it's slammed towards women.
Right.
So what do you
as I've just mentioned, abortion is healthcare. So by limiting it, we are not only limiting those that are seeking abortions because they don't want to be pregnant, but we're also limiting it for those that might have ectopic pregnancies, that might have life-threatening conditions, that might have miscarriages. So I think, again, that's a really important way of how we're framing it. But to speak to that, just to speak to that concern, because I hear it a lot too, which is, oh, but people use it as birth control. So that's not found in the research, particularly looking at the Turnaway study. And that is the study in terms of abortion research. It really looks at reasons why people seek out abortion care. It seeks out, how they feel after the abortion, and it was longitudinal. So not only did it look at 6 months after the abortion, but up to 5 years. So that's a whole lot of consequence for those that were turned away. And the Turnaway study is called that because it compared a like group of people. It compared people who were seeking abortions and were able to obtain one, and a group of people who were seeking abortions and who were not able to obtain one. And so those are like groups. That's apples to apples. That's not people who wanted an abortion and people who had a miscarriage. Those are not apples to apples. So that was one of the groundbreaking things about this study. And one of the pieces that came from it was people are not using abortion as birth control. Because abortion, especially in states like Ohio that already have restrictions in place, it is not an easy form of birth control. It is much easier for me to use a condom. I can buy that at the drugstore or the grocery store. A birth control pill, at least in my state, a pharmacist can fill that prescription. I don't need it. I don't need it from a doctor, which is pretty amazing. There are other ways of having even long-acting birth control, like an IUD, where it's one time I get it implanted and it's good for 5 years. So if we're thinking about abortion as birth control, it's not as simple as any of those things. Probably the IUD is the most challenging of the things that I listed, But abortion is even more difficult because I need to go in, I need to have confirmation of dates, I need to come back because there's a waiting period I need to think about. So I need to take time off of work. That means loss of income. I need to drive someplace. I need to get the appointments. I need to pay for it all. That's a lot of work when I could have spent $3 for a box of condoms.
Mhm. And I'm just, again, I'm in my devil's advocate brain. If
Sure.
it is, from that place of, oh, men don't want to use condoms, this, that, and the other, you're looking at the wrong gender here. And I want to be clear that, we use the term birthing person now because people of all genders need abortions.
100%.
I'm pretty passionate in kind of the Ruth Bader Ginsburg idea that this is the only thing that truly brings equity to women
Yeah.
in society. I won't go down that rabbit hole. I'll stick to just some of the objections that I've heard. So the other thing, and this is something I obviously got schooled in pretty heavily growing up in conservative religion, is that people regret their abortions. It causes long-term psychological damage. And usually studies from likes of the Family Research Council, which is a conservative think tank, are cited in making those kind of claims. Tell us about that vehement head shake that you gave with, abortion causes long-term psychological damage.
So again, we know this from the Turnaway study that is absolutely not the case. One of the things that we know is that 95% of people, and in the Turnaway study, they identify as women in the study. So I'm going to use that language only because I am speaking about a known study that's been published versus me putting on my own. So in the Turnaway study, they found that 95% of women felt relief after their abortion.
Mhm.
That there might have been other feelings too that might have emerged, but those were really temporary kinds of feelings. What is interesting is when we think about regret, right? There's so many different pieces to that idea of what is regret. And I think oftentimes from religious places, they use regret simultaneously with guilt and shame, just as concepts. And so it's like, well, you might regret this. Well, you know what? There's a lot of things in life that maybe I regret, or maybe I don't. Like, had a tattoo when I was 18. Is it the tattoo I would choose now in my 40s? Definitely not. Do I regret it? No, it was a part of me. Like, was that a choice I'd make again? No, but that's really different than thinking about regret. Like, there's not that shame, there's not that guilt. Now, yeah, my religion isn't cool with tattoos, but
Mhm.
oh well, I knew that going in. That was okay. That's on me.
Yeah.
So, I think it becomes a tool to use because it's not based in what reality is. Now, as I said, of course, there are people that are going to feel all sorts of ways. So I can't control how people feel, and that's okay. But if we're talking about this small group of people that might feel regret, and we're going to now ban something for the large majority who don't feel regret, that circle doesn't square.
Yeah. It makes sense to me now. I often, when I have these conversations, I try to think of like where I came from and how I was raised and how a lot of these messages were implanted, and even use of this term post-abortion syndrome that was kind of presented in conservative church like it was a fact that would happen afterwards. Then when you look at the larger body of literature and really
Well,
other people with lived experience, it's a different story.
when we think about post-abortion syndrome, I really appreciate the work that the American Psychological Association did way back in 2008. And they're like, we're going to do a deep dive on abortion and what are the psychological ramifications, if any.
Mhm.
And what they came up with is post-abortion syndrome is bunk. It's not a thing. So again, the Turnaway study echoes that in actual good research that's apples to apples. And so it shows that it's not regret, it's relief. It does begin with an R though, so I can understand if people might not quite get the two.
Yeah. I think the final thing I want to stress is, from your understanding, from your perspective, another term that I'm glad is being used in Ohio in some of our campaigns is forced birth, ban forced birth.
Hmm.
I think that's right on. What are the long-term consequences in general that you've seen of forced,
So,
especially with people who, are marginalized or don't have the resources?
yeah, so let's start there, right? So we can look at this through lots of different lenses. We can look at it in terms of an economic lens. We can look at it in terms of a pay gap lens. We can look at it in terms of an education lens. We can look at it in terms of what are the outcomes of the offspring that are born to parents who were not ready to be parents and did not want to be parents, right? But who had no choice around it. We're seeing some wonderful firsthand stories come out. So I think about a woman who was in Texas and was pregnant, wanted an abortion, and wasn't able to access it because the Texas law just passed.
Mhm.
And so she ended up having to carry to term. She gave birth to twins. She was 17, 18 at the time, trying to make it work with the person who um, had co-responsibility in that pregnancy, and just being able to read about those ups and downs. And I think what's really hard is, once a person is here, it's much harder to sort of imagine life without them. But what she was able clearly to talk about is, life is really hard, and it wouldn't be this hard if her kids weren't here, and she loves her kids. So we're holding those two really disparate things, that life is really hard, but now that I know these kids, I love them and I can't imagine it being differently, but I wish life wasn't so hard. So we're looking at the economic potential that doesn't get realized, the education potential that doesn't get realized. We're looking at the gaps in terms of trying to close some of the gaps between the racial gaps of socioeconomic status. And so we continue to perpetuate those that are poor staying poor. And it serves the people who make these laws, because they are protecting what they have.
And and again, if I may go here,
I mean, I just went there, so go.
the axiom of keeping women barefoot and pregnant.
100%. As I said, it tends to benefit the mostly cisgender white men that make these laws, the ones that never have to experience pregnancy. And it's interesting because they care so much about the preborn, but what are they doing about child support? What are they doing about WIC? What are they doing about expanding Medicaid for all? What are they doing about other programs that actually help these children once they come into the world? I mean, George Carlin nailed it in the 80s, and that hasn't changed.
And to that point, I shared this a little bit on the previous interview I did with Mark Sandlin, but I'll go into more depth here since you mentioned Medicaid. I know the turning point for me as a young professional who was deconstructing from very conservative Christian religion was, I was working in a publicly funded agency with a client who was on Medicaid, which so many of the legislatures you're talking about wouldn't want this woman to have. And she was, on that tipping point of deciding, do I carry this child to term or not? And my objective was never to get her to keep the baby, because I was a clinician. That was not my role to influence her decision. I was doing what clinicians do and held space and helped her wade through everything. And interestingly, she ended up having the baby. And it just dawned on me in that moment. And she also had access to mental health services throughout this process, in a program that most of the people voting against abortion healthcare would not want her to have.
Well, I'm sure that program's been cut by now. So, yeah.
That was when I was convicted about the hypocrisy of it all. And I was my viewpoint as a deconstructing Christian was changed for good at that point, because I really, it would took that client to help me to see through it.
Yeah, well, again, to say that somebody has to do anything with their body, first of all, it's not for me to say what anyone else should do with their body. So I mentioned tattoos, right? Like, who am I to say whether that's right or wrong for anyone else? I get to make that choice for myself. We talk about the vaccine, right?
Mhm.
And one of the criticisms was this idea that because of public health, that was something that was strongly encouraged and made accessible. In some workplaces, it was mandated in terms of that. And the ironic
Mhm.
point around it was my body, my choice.
Mhm.
I'm like, wait a second, if you get to choose about a vaccine that goes in you or that doesn't go in you, but that virus you might get that might kill me, why can't I choose about a fetus, not even a baby yet, that I can't care for, or I don't want, or I can't have, or I'm taking medication and it's contraindicated in pregnancy, but I need to stay on that medication for my mental health or my physical health,
Yep.
or that cancer treatment that I need.
Dr. Julie, I feel we can talk forever about this, and I thank you very much for taking the time you have to give us this interview today. Again, election in Ohio is November 7th. Voter registration deadline is October 10th. And I'll put the link to that in the notes for this interview. Please reshare this on your social media, especially if you know of Ohio voters who might be looking at your page.
I
And
do.
thank you so much, Julie, for joining us.
You can do it, Ohio.